Hello everybody, my name is Dr. Elizabeth Dubil. I'm a GYN oncologist. I practice full scope gynecology and cancer care in gynecology here in Iowa for you. September is Gynecologic Cancer Awareness Month, and so I wanted to sit and share with you some common symptoms of some of the gynecologic cancers so you can make sure that the women in your life are healthy and happy. The most common gynecologic cancer is uterine cancer. Uterine cancer accounts for the majority of cancers diagnosed, but the great news is that the majority of women can be cured if caught early. So what are the signs that you should be looking out for, right? Any bleeding after menopause is something that you should come and see me for. If you have irregular bleeding between periods, abdominal bloating, or pelvic pain or pressure, those are things that are concerning that you should see us for. Uterine cancer, when caught early, is most often cured with surgery, which we can do here at Decatur County Hospital. Some of the signs and symptoms of cervical cancer are pelvic pain, pain with sex, bleeding after sex, or abnormal bleeding between periods. The majority of cervical cancers are caused by a virus called human papillomavirus, which we have an effective vaccine against. The recommended ages for vaccination are between ages 11 and 12 for boys and girls, but you can be vaccinated between the ages of 9 and 26. Vaccines are approved all the way up to the age of 45, but if you are 27 years and older, please talk with your doctor and make sure that that is the right vaccine for you. Cervical cancer is highly preventable because of the vaccine and because we have great screening, but it can be confusing to know when you need a pap smear. We used to do pap smears every year, but we found that we were over-screening, and so now pap smears are done between the ages of 21 and 65, and your doctor might say that you need it every 3 years or every 5 years, and that's dependent on the type of test that they get. If you've had an abnormal pap smear, we may see you sooner, so it's incredibly important for you to know the results of your pap smear to know when you have to come back next. Early cervical cancer can be treated with surgery, either by removing the cervix and leaving the uterus if fertility is desired, or by removing the cervix and the uterus. Advanced cervical cancer is treated either with a combination of radiation and chemotherapy or chemotherapy alone. Ovarian cancer we call the silent cancer because the signs and symptoms can be confusing. Signs and symptoms of ovarian cancer are things like fatigue, bloating, constipation, loss of appetite, abdominal swelling, and weight loss. And so it's important that if you or a loved one is experiencing this and it's persistent, to go into your doctor and be checked. Make sure that you don't have ovarian cancer. The risk of ovarian cancer in the general population is quite low. It's about 1.2%, but if you have any family history of ovarian cancer, then that goes up substantially and we can offer genetic testing. Because ovarian cancer is so tricky with its symptoms, the majority of time when it's diagnosed, it's already advanced stage. The most common treatments for ovarian cancer are surgery and chemotherapy combined. The signs of vulvar cancer are also a little bit discreet. They can present as persistent itching, bleeding that's atypical, or a lump or a mass, or just changes in your skin texture. It's important to know what your vulva looks like, and so you can look with a mirror. You can get a mirror at an auto parts store that has an angle to it so it's easier to see, or have somebody help you. If you have any questions or concerns, please come and see me and I will look for you and make sure that everything's okay. If vulvar cancer is caught early, we can treat it with excision. Late vulvar cancer, we sometimes excise as well, but we'll often treat with radiation and chemotherapy. Chemotherapy can be a really scary word, and cancer can be a really scary diagnosis, but here we have a team that's dedicated to stepping you through it every step of the way and being there with you and for you. In gynecologic cancer over the last few years, we've had a robust change in the type of chemotherapies that we give. We still have the traditional chemotherapies that we give through your veins once every 3 or 4 weeks, but we have found that there is a wide array of biologics and immunotherapy that is fantastic in these diseases and can be utilized as well. These medications are more targeted towards the cancer and therefore have less side effects that affect you. And so we're happy to offer you that here as well. I'm happy to offer a full array of gynecologic services here in addition to cancer services. So if you have questions about menstrual health, about contraception, about menstrual suppression, tubal ligation, surgeries for ovarian cysts, PCOS, family history of cancers, or anything really that bothers you with sex or gynecologic health, I am here to help.